Okay. Hello, everybody. Disconnect my phone here. And we are live with another Holistic Health Hour. So let me get the chat ready. If you guys have chat questions, make sure you chat in the questions. And as always, you always have the ability to go to holistichealthhour.com, holistichealthhour.com, and ask the questions prior to this time, which many of you already did. So we have several questions to go over beforehand. But I do know that, in my other Zoom calls and presentations, as we're talking about different things, you think about different things. So you're reminded about somebody in your life that has issues, or you that may have issues, that maybe you have a question. So I know we're starting a couple minutes early. So give you a little bit more information. Our ConnorsClinic.com also, and I refer to this each time, but make sure you go to that if you have questions as well, because I don't want you to have to wait till Wednesday to get your questions answered. On ConnorsClinic.com, we have well over 1,000 blog posts that may address the question that you have. So go to that. We have a really nice search bar on Connors Clinic. You can search for different questions on our blog post. We have lots of pages, probably 1,500 different pages if you include all our blog post pages. Also on our YouTube channel and our own video channel, connorsclinic.com, we have well over 1,100 videos that you could search for different topics that you might be interested in. It's quite possible that I made a video about it. So again, holistichealthhour.com is where you'd post questions. And let's jump to some of those questions. First one, my wife thinks that she may have a bladder infection. She has to get up several times a night to urinate. There is sometimes a foul odor. She has pain, or she has no pain or other symptoms. What's a good supplement to take to help support her bladder health? Thank you for your help. So if you think that you have a bladder infection, so many times the first sign of a bladder infection is just increased urination output. Lots of times people with bladder infections have no pain. And interesting to note, as people age, like in your 70s, 80s, you're 80-year-old, many times the only symptom to a bladder infection is abnormal thought patterns, abnormal behavior. So in a geriatric population, you'll just see someone kind of out of it, kind of talking gibberish, talking like, what's the matter with this person? First thing you need to suspect is a hidden UTI. Many times they don't have any urinary issues. As a younger person, urinary issues may be the first sign. Different odors of the urine can be a sign. That can be more a sign of candida type issues, especially if it's a yeasty odor. But what would you do about it if you suspect it? First of all, it's good to get a culture. You can even get your old urinary dipsticks on Amazon, and you can test whether you have bacteria in your urine. Or go to the doctor and get a UA to see if you have bacteria in the urine. If you do have bacteria in the urine, they're going to recommend a culture, which would be the most appropriate thing. Sometimes doctors will just reach for their pad and give out a prescription for an antibiotic. If you're so inclined to not want to do antibiotics and want to do a natural approach, things like D-mannose, which is a sugar, can be extremely helpful for urinary tract infections. If you look at our store, And to get to our store, you can go to connorsclinic.com. In the upper right-hand corner of the website, you'll see shop or store. Click on that and you'll go to our store, and you can search urinary tract infections or search D-Mannose, M-A-N-N-O-S-E. We have several products that are high-dose D-Mannose that are specifically for UTIs. We also have specific products for Candida. So if you search for Candida and yeast infections, you'll see different products. Because if it's a Candida, you do want to treat it a little bit differently. D-Mannose can help with that as well, but treating it to rebalance the flora can be is something you need to address as well. Because Candida is an imbalance in the flora. And usually it's not just affecting the UTI, it's usually affecting the gut, and getting some balance in your microbiota can be beneficial. Question comes in on the chat. Facebook user, can you explain what is having smooth muscle antibodies? So when you have antibodies to self-tissue, that's an autoimmune disease. Smooth muscle antibodies, I don't know. I'd have to research that a little bit. But any type of autoimmune disease means that you have antibodies to self-tissue. If you have antibodies to self-tissue, then you're in a totally different ball of wax is how you should be treating yourself from a nutritional dietary protocol. I'd highly recommend, not that I just want to push a product, but I'd highly recommend you spend $50 and join our autoimmune course, because so once you have self-antibodies, if you're going to be taking immune stimulants, because many times you are, so if you're what naturally minded, you might be taking immune stimulants because, especially during the recent COVID thing, a lot of people were taking immune stimulants. If those people had self-antibodies, many people found out that they had an autoimmune disease because that was a certain time in their life that they started taking a lot of immune stimulants and they felt worse. If you have self-antibodies, antibodies to self-tissue, and you're going to take products that are direct immune stimulants, you're going to kill that which you have antibodies against first, which is going to be self-tissue. So if you have antibodies to smooth muscle tissue, you're going to end up with problems. Smooth muscles line your arteries. You're going to end up with issues with blood pressure. You're going to end up with, some smooth muscles line other things too. But your biggest thing as far as symptom pattern is going to be arterial. So it's going to have blood pressure issues. So you want to be careful. That's why I highly suggest that people, when they have, serious health issues, that they run antibody tests. So typically, if we do a case review and a person has had health issues for a period of time, they've been to multiple doctors, nobody's ever done an antibody test. We need to find out, do you have self-antibodies? Because you could be completely treating this wrong. A lot of times people will say, I think you have Lyme, so we're going to give you cat's claw, and blah, 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 blah. And they're giving them these things, and the person's continuing to get sick, and the doctor will say, no, you're just having a Herxheimer reaction. You need to work through this. This is a good thing. It's not a good thing. So if you're stimulating immune system function and you have self-antibodies, antibodies to your tissue, you're going to feel worse because you're going to have more destruction of whatever you have antibodies against. So, for the $50 to learn how to look at autoimmune disease the right way, it's a small investment. Certainly you can do a case review with me too, but if you know that you have self-antibodies, you have an autoimmune disease, spend the $50 on that course and start working through it. You'll have a ton of aha moments, and then you can make a case review set up a case review with me, and we can go over, different possible treatment parameters. Next question. I have MS and trigeminal neuralgia. Which module is best? 7 stages? Which course is best? So I think that's what you're asking. Is the 7 phases of detox the best course? No. I would say chronic disease and autoimmune would be the best course, because MS is an autoimmune disease. So MS is, you have antibodies to myelin sheath cells. So now you have an autoimmune destruction of your myelin sheath. So MS is a demyelinating disease. And the rate of demyelination is going to be dependent upon the rate of destruction. And the rate of destruction is going to be dependent upon you getting a handle on what are the triggers in the immune destruction of the myelin sheath cell. So go back to what I just said about autoimmune disease. If you have antibodies to myelin sheath cells, you need to find out what's triggering your immune response. It could be what I just mentioned. I'm taking a bunch of immune stimulants because my naturopath told me to take it, or I read that this is good for it. That's really absolutely the wrong thing to do. So no, wait. Let's say another patient, I'm not taking any of that stuff. I'm not doing any of that stuff. Well, if you're stimulating your immune system in another way, maybe like eating a food that you have antibodies against. So let's say you have antibodies against gluten and you're eating gluten, it's stimulating an immune uptick and you're destroying more myelin sheath cells. So very destructive. So you got to find those triggers. And I go through that in, ad nausea on that course. So I think that would be the best course to take. Trigeminal neuralgia is different. So trigeminal neuralgia is not a disease. So trigeminal neuralgia is an inflammation of the trigeminal nerve. So the trigeminal nerve is your cranial nerve that controls part of the motor function of your face. It can be extremely painful. There are many different causes to it. So it's not a disease that has just one cause. There can be many different scenarios, and that can be, has to do with inflammation from, from a secondary autoimmune disease like MS. You could have inflammation due to, from a chiropractic issue with your cervical spine. You could have inflammation due to just a myriad of different things. So digging to find out what the cause of that inflammation is and calming that down is going to be key. Over the years, I've worked with multiple trigeminal neuralgia patients from a functional structural point of view, and we had great success. So you want to address it from a structural point of view, an inflammatory point of view, an autoimmune point of view, and you're going to have good success. I would not suggest the detoxification course. I'd suggest the autoimmune course. Any tips on PMR? Not medical advice, but for an 83-year-old patient. Again, with PMR, you have to get to the cause of things. Like any disorder you have going on, you want to get to the cause of things. From a medical standpoint, with polymyalgia, any polymyalgia issues, they're typically just going to give you pain medication. From a functional standpoint, it's many times looked at as a chronic inflammation issue. Looking at blood work, you might find an increase in your inflammatory markers. Typically, blood work that's done on these type of people is just going to be a CBC and a complete metabolic panel. This is where I advocate highly into looking at autoimmune panels too. If you have antibodies to self-tissue, that's going to be a huge issue that you want to deal with. So digging into deeper blood work is going to be the key to that. And that's really honestly the key to so many disorders. So many people are struggling with things that the things that I hear are I've been to multiple doctors and I don't know how to treat this. Nobody's gotten to the bottom of this. And then you ask for that patient to send in all their labs, and it's amazing how few labs many times that people have, or all they've had done is a CBC and a complete metabolic panel through their GP. And sometimes it's really disturbing because sometimes they've even had gross abnormalities in that, and nothing was investigated and nothing was moved forward. Many times people can have overwhelming symptoms because they have an anemia, but then nobody ever addresses the anemia. Um, Back to another question on the Facebook page, any dietary changes for PMR? Just overall, there's some inflammatory process going on. So a person would do much better going on an anti-inflammatory diet. You could just Google an anti-inflammatory diet. That would help. I would highly suspect, though, um, that there's specific dietary antibodies. Common um, with with this would be gluten. Also, possibly lectins could be an issue because you could actually have a rheumatoid factor positive. That would be the benefit of doing an antibody test. And then if RA is antibodies are present, then I would say lectins could be a big culprit. So you could look up a low lectin diet or a lectin-free diet, certainly gluten-free diet, and just overall just an anti-inflammatory diet. And like anything, when you have an uptick of inflammation, systemic inflammation in the body, you always have to think that there's inflammation in the gut. That's why food sensitivity panels like a Cyrex Array 10 would be the right choice in something like this, because it's amazing what you could do when you calm down the gut, what you could do from a systemic standpoint. I've had people with inflammatory arthritides, they were diagnosed with psoriatic arthritis or rheumatoid arthritis, and we just cleaned up the gut and did a Cyrex Array 10, cleaned up the gut with diet, things that are causing inflammation in the gut, and all their symptoms calmed down. Now, the longer you have an arthritide like that, you have bony changes. You're never going to change those bony changes, but if you could decrease the inflammation, you could decrease 95% of the patient's symptoms. So like anything, you're always looking for the cause. You're always looking for the source. So you're going to be digging to that source. And, it's not enough to say, oh, you have inflammation. Your C-reactive protein is high. Your fibrinogen is high. Something like that. You want to go, okay, well, why is that? What is the cause of that as well? So digging to that is important. Next question. Remember holistichealthhour.com, where you can submit your questions prior to this, so you make sure they get answered when we get to it. I have a full body red light and infrared light therapy device. I have heard that mixed things about using this when you have cancer. I currently have breast cancer. I'm also using a Rife machine. What do you think about this? Thank you. I don't think there's any problem with using red light therapy. Infrared light therapy is just fine too. I will caution you that if you have an infrared light therapy that costs you less than $5,000, it's probably got less than 1% really true infrared light. And I don't mean to burst anybody's bubble, but that's just the truth. True infrared therapy light, it's going to be $5,000-$6,000. And infrared therapy, the positive of that is that you get this deep heat, and that's where you end up with, it's basically a hyperthermia wherever you put that infrared. And one of the ways that you'll know that it's a better infrared device, not just the cost, is that there will be no light. So true infrared does not produce light. Now, I'm not saying a red light therapy that claims to have infrared light doesn't have benefits. Light therapy has benefits, but it's not going to go deep, and it's not going to produce deep heat. So there's a lot of companies that use false data, or maybe I should say that steal research that's out there that's not based upon their device. And you see that in like the PMF industry. The research on PMF devices is all on high Gauss PMF devices, and then companies that sell a PMF device that's a very low Gauss uses that same research to say this is what PEMF does. And the truth is, that's not what your PMF will do, because you have a machine that produces 700 Gauss. The research was done on a machine that produces 30,000 Gauss. So you just got to be careful with claims that are made by different companies. But there certainly can be no harm done. You just got to be careful in what machines you spend money on. Next question. Dr. Connors, I emailed you pictures of what I believe to be a piece of the tumor that I coughed out. I'm wondering if it's possible to cough or pass tumors as a response to alternative treatments. The answer is yes. It's very possible to cough out tissue or pass tissue in the case of colon cancer or rectal cancer that is cancerous. This has happened multiple times in the past. I've even had patients bring it in to get tested, but that's the only way you would absolutely know for sure, is to bring it into a path lab and have it tested whether there's cancer cells in that. Do we know? Does it matter? Well, yes and no. You're trying to get rid of the cancer that's in your lungs. If you coughed something out and there's a distinct blob that looks very different, I've never had this happen before. Could this be tumor? The only way to know for sure is to get a pathology report on that. Whether your path lab would do that, whether your oncologist would play a part of that or not, I don't know. But that would be the only way to know for sure. So that's not always doable. But is it possible? That's the question. The answer is yes, it's very possible. So hopefully that is what happened. Next question, I left this in small font, so excuse me. Do you have any experience with meningioma? So meningioma is a tumor on the meninges. That's a part of the brain, the cases the nerves and brain itself. I was wondering if there's a holistic treatment that restores the secretion of Merlin enzyme and that suppresses tumor growth. So with meningiomas, with the different tumors, with the different nerve tumors, there's a gene called the NF2 gene that is neurofibroma factor 2 or something like that. Because with neurofibromas, that's a common disorder that is genetic, where a person will get these lumps all over, and these are fibrous tumors that are benign and typically stay benign, but it's genetic and it can be embarrassing, and it's not, doesn't look good. You can get them on your face and it's unpleasant. Well, they found that it's a defect in this gene, and it's a tumor suppressor gene. So they called it neurofibroma 2, I think. And it's a tumor suppressor gene. And the tumor suppressor gene makes an enzyme, which is called Merlin. And that Merlin enzyme then helps silence tumor growth. So the purpose of tumor suppressor genes is that, let's say if I have a cancer that starts in a cell. So again, cancer starts with just one cell. It's a normal cell that is damaged. So something gets inside that cell, whether it's a toxin or a biotoxin of some sort, that damages the nucleus, and then it starts a reproductive phase. So that starts to rapidly reproduce. Well, then it kicks on these tumor suppressor genes. This is why everybody doesn't have cancer. So these tumor suppressor genes kick on, and they produce enzymes that stimulate intrinsic apoptotic cycles. So they stimulate the death of the cell from the inside. So apoptosis is normal programmed cell death, and that's what you want to stimulate. So that's what a tumor suppressor gene basically turns on, is this intrinsic apoptosis. So the cancer cell dies. So, and then you never know you had cancer. So the truth is that everybody has cancer all the time, but your body is fighting it and destroying it largely due to these tumor suppressor genes. But if I have genetic defects in these tumor suppressor genes, then I'm not causing this intrinsic apoptotic response. I'm getting a less intrinsic apoptotic response. So I have a greater chance that this continues to reproduce, whether it's a tumor or whether it's a malignant cancer. Now, with NF2 defects, you could get neurofibromatosis, but you could also get other brain tumors, and meningiomas are one of those things. Now, honestly, I haven't really researched what would be the nutritional intervention for someone with NF2 defects, but I will say in general, with so many of the other tumor suppressor genes, if a person has defects in those tumor suppressor genes, one major component that can be an intervention would be curcumin. So curcumin or turmeric can help, has been proven to help those with P53 gene defects, which is another tumor suppressor genes, with BRCA gene defects. Also, resveratrol and green tea extract can help with those. And I think that the mechanism of action on that is that it decreases IL-6 and decreases the expression of mTOR. So mTOR is a whole other discussion, and I actually have some videos on mTOR. I do know that that Merlin and the tumor suppressor gene that's associated with it does tie to mTOR as well, and lack thereof of production of Merlin increases mTOR function. And go to, let's see, I bet you if you go to connersclinic.com and you search for mTOR, M, capital small m, capital TOR, you'll see that pathway, and you'll see some videos I created. If it's not on connersclinic.com, if you go to our YouTube channel or our videos.connersclinic.com and you search for mTOR, you'll see some videos I created on that. The mTOR pathway is essential to understand if you have tumors or cancer, because what you want to do is to suppress that mTOR pathway. Now, some of the things that, again, how would you deal with this? Some of the things that stimulate the mTOR pathway even more are listed in that video. So I would think from a dietary standpoint, things like dairy stimulate the mTOR pathway. That's why it's good for most cancer patients to be off of dairy, because it has growth factors in it. Things that will increase IGF-1 levels, things that will increase estrogen levels and imbalances in hormones. So if you look through that, I think you'll find the best information on that. Okay, some other questions came in. Good day, sir. I have constant pain in the balls of my feet. I don't know so many therapy blood tests. Hard to understand that question. Feeling pain. I think I live in Holland. Okay, so if you could help reformulate that question and submit that again, I would appreciate that. Toddler having foul diarrhea today after eating sand yesterday. What can I do to support the digestion through this? Sometimes the best thing you can do, honestly, is to let it pass. So I'd be more concerned if your toddler ate sand and then they were constipated. Then you'd want to do things to help remove that. Sometimes when you understand, if you get sick and you are vomiting, sometimes the way that we have been taught through the medical system is that we got to stop this vomiting. So we're going to give this person Tylenol. We're going to give this person, to decrease the fever. My child has a fever, so I'm going to give them Tylenol to decrease the fever. Yes, I've decreased the fever. I've solved the problem. Well, actually, you probably made the problem much worse. The body caused this increased fever state to kill off an infection. The body is causing you to expel your stomach contents to deal with an infection. So you're expelling your stomach contents. Now, of course, there's limits to how high a fever you want to get, and there's limits to a person, having just explosive vomiting that is uncontrollable. Same thing with diarrhea. You have to get to the root of things, right? But same thing with diarrhea. If a person's got, diarrhea and you can pinpoint it to they ate sand, maybe it was, it was just the irritation of the sand, the silicon or whatever that's in that sand or the rocks that's in there, that they're expelling that. It's a good thing that they're expelling that. So if we could all start to think that way a little better of why the body is doing this, it could give us more clues to what's going on, and it could give us more clues to maybe this is a good thing that's going on. We should just let it go on. That can be even better. Have you heard how to treat burning mouth? My mother has it. So burning mouth is actually a syndrome. I'd have to look that up again. Actually, somebody had that question a few months ago, and quite honestly, I can't remember. I did research that, but I can't remember what that was tied to. I apologize. I could look that up and hopefully answer that next week for you. One of the things you'll find about me is I'm not going to baloney through an answer that I don't know. So, gosh, somebody asked that. Maybe it was on our other Zoom call. It was probably a year ago or something like that. And I did look that up, but I'll have to look that up again and see. So I can answer that next time. Some other questions that came in on the Holistic Health Hour site. Do you recommend doing parasite protocols regularly, whether you have symptoms or not? And if so, how often? Is it beneficial to let the body rest and recuperate after a certain amount of time if there are symptoms of die-offs once you are doing a parasite cleanse? Is there a particular type of protocol that you would recommend? Herbal parasite supplements or parasite medications? Well, there's a lot of questions there. Do I recommend doing a parasite cleanse on a regular basis? Yeah, I do. I personally do. But remember, there's different types of parasites. So there's intestinal parasites. There's parasites that could go systemic. There's parasites that are not truly parasites, but they're bacteria that are basically parasitic. And so they need to be treated a little bit differently. Personally, I use our private label product called ParaClear because it has things in there that will help with intestinal parasites and worms, and things in there that will help with bacterial type parasitic things like H. pylori, which is a bacterial infection, but kind of acts like a parasite because it can be very long term. You could have it for years and spread it like crazy and just get it back again, and it could cause a whole lot of ill health. That's why I like ParaClear, because it has the things in there that will help with that. So there are other parasite programs out there. We have some products from Cellcore. They have a parasite protocol bundle with different herbs in it in each supplement, and you take these 3 or 4 supplements and you go through a month of this, and that can be a nice cleanse. The reason why I personally like the ParaClear is because though you have to take more, you have to take the same amount of pills. They're all in one bottle. So you're getting it all in one bottle. You might, if you feel like you have parasites, like when I take ParaClear, matter of fact, I just did this with my wife just last week. For about a week, I took anywhere between 9 and 12 capsules a day. I only did it for like 3 or 4 days. I think I skipped a day, and because I'm not very good at taking supplements sometimes, and I forgot, I got busy. But I think it really does help clear any parasites, any bacteria. And I always have the fear of H. pylori. When you really understand H. pylori, I think you should treat it on a regular basis. Doing that, 3 or 4 days once every month, I think is extremely beneficial. Second part of this question, should you use a binder? Would you have to worry about die-offs when you're doing a parasite cleanse? So if you're doing a parasite cleanse that's dealing with parasites that are in your gut or in your liver, like liver flukes, no, you don't really have to worry about die-offs at all. You're going to expel that. Again, you got to make sure all your phases of detoxification are open. If you're constipated, you're only having a bowel movement every 3 days, you got to deal with that before you even think about doing a parasite cleanse. So, but if you're moving your bowels at least once, twice a day, no, you shouldn't have any issue with die-offs. If you feel like you're getting, if you do a parasite cleanse, like using a product like Paraclear that has berberine in it and garlic in it, and you're getting Herxheimer type reactions, then you need to rethink what you possibly have going on. So the only thing that's going to truly give you a Herxheimer type reaction is if you're dealing with a gram-negative bacteria, because they have lipopolysaccharides in their cell membrane. When they die, that's going to stimulate it. In response, you're going to feel yucky because you're just producing too many endotoxins. And that is in the blood, that's not in the gut. So using a binder can be helpful no matter what you're dealing with. So adding a binder to your protocol, taking that on an empty stomach can be helpful. But if you're starting to get Herxheimer reactions, you need to rethink really what it is that you could be killing with that. Or if you have to be careful while you're doing something like that too. If you're taking something with garlic in it, which is something that you'd use typically for H. pylori and for parasites, that's going to be an immune stimulant, and you do have to be aware of that if you know you have an autoimmune disease. That's why I think if you know you have an autoimmune disease, let's say if you have Hashimoto's and you think you have parasites, doing these short-term parasite cleanse, like 3 or 4 days out of the month, are actually much healthier for you. If you do a month-long parasite protocol that has immune stimulants in it, and you already know you have an autoimmune disease, like you already were diagnosed with thyroid antibodies, so you have Hashimoto's, you're going to make your thyroid worse during that time. So I wouldn't do that. So remember, if you're going to stimulate your immune system, you want to do it for a short period of time if you have autoantibodies, if you have antibodies to self-tissue, because you will kill that which you have antibodies against first, which is your thyroid gland in this instance. So be careful of that. Next question came in online with chat. Do you suggest any natural way to address AFib? Currently on medication, but would like to consider a natural supplement under a professional healthcare provider. So again, you want to look for what could be the cause. So AFib has to do with multiple different possible causes. The simplest cause of AFib can be a deficiency in vitamin D. And issues with vitamin D receptors. You could have genetic issues with vitamin D receptors, and those people tend to take vitamin D and can't get their blood vitamin D levels up. And an imbalance in vitamin D affects the calcium channels in the endothelial layer, affects the blood pressure, and affects the sinoatrial node, and can cause AFib. So years ago, I remember one of my patients years ago said her mom was in AFib and they were going to paddle her. She was completely awake and they didn't want to do that. I discussed this with her. She brought a bottle of liquid dropper vitamin D in, gave her 30,000 IUs of vitamin D, took her out of AFib immediately. Now, I'm not saying that works with everybody, but that is the simplest solution to it if that is the issue. So getting to the issue of AFib. Other issues with AFib are inflammation in the brain itself. So the midbrain is where you have control over that the issues with the SA node, and inflammation in the midbrain can cause a chronic AFib issue. How would you know that? Well, there's a video. If you go back to connorsclinic.com and you search in the search thing, search neuroinflammation, neuro, N-E-U-R-O, inflammation. I've created a video on that. It's a half-hour video. Highly suggest you take a half hour of your day and watch that. There's a phenomena that is quite common with people that have, there's multiple different sources of neuroinflammation and brain inflammation. And many times, most time, people don't know that they have it. They just have other symptoms and have been given labels of other diseases or syndromes, and it's stemming from neuroinflammation. So you have to look at causes of neuroinflammation and how to treat it. There's a whole phenomena called microglial priming. I go into that into detail. And then a step further is to be tested for neural antibodies, which would be a Cyrex Array 7X test. If you have neural antibodies and or to a lesser degree you have microglial priming, neural inflammation could cause all sorts of problems, and AFib is just one of the possibilities. All right, next question came in on the not on the chat, but on the Holistic Health Hour site. My mom has taken Bactrim and turns out she's allergic to it. The last dose of Bactrim was a week and a half ago. She's still experiencing intense symptoms and she's been in the hospital twice. Any recommendations how to get this out of her system? She's on a probiotic to help her gut now. Yeah, it's hard when you have an allergic reaction to a medication because the allergic reaction to the medication can linger for a long time. And part of the reason it can linger for a long time is because you might have actually, so let's take a step back. A lot of people will go, we need to detox that medication. We're going to support detoxification pathways and try to get that medication out of the system. It could be lingering in the tissues. It could be still causing problems. That can be true. But why do some people, after a medication or some source of exposure to something, seemingly continue to have symptoms long periods of time afterwards? The answer to that really lies in what that allergic reaction to that medication did to the person. The truth is there may be nothing more to detoxify. That may be gone. If there may not even be a way to find out, but if there was a way to find out, that product might not be in the person's symptom in the person's system anymore. Well, why would they still be having problems? Because it stimulated a reaction. It stimulated an inflammatory reaction, and that inflammatory reaction just upticked that person's current issue that they had that was lying dormant. And a perfect example of that is what I was just discussing a few minutes ago with neuroinflammation. If you have prime microglial cells in the brain, and of course, this is gibberish unless you watch that video. So go to connorsclinic.com, search for neuroinflammation, watch the 30-minute video. I explain microglial cells, what they are in the brain. They're the brain's immune system. If they become damaged, and they can become damaged from a myriad of different reasons, and you could have basically not an idea that that has taken place, because you have accredited your symptoms to other things. You have other diseases, you have other problems, but it can be stemming from microglial priming. And so if you have prime microglial cells, anything can trigger prime microglial cells to go into this state that's called this inflamed state, this M1 state. So they stay in this inflamed state and they're just spewing out inflammatory cytokines. When they're doing that, depending on where these microglial cells are in your brain, they can affect you, in all sorts of different ways. If they're the parietal lobes of the brain, they're going to affect your sensory nervous system, so they could cause pain and inflammation in various parts of the body. If they're in your motor cortex, they're going to cause motor issues. You're going to have issues with function, issues with muscle function, issues with coordination. If they're in your cerebellum, you're going to have major coordination issues. If they're in your prefrontal cortex, you're going to have thought process and cloudy thinking and so depending on where you remember, your brain controls everything, right? So if you have inflammation, areas that are in your brain that are spewing out inflammatory cytokines, you could have just a myriad of different type of symptoms. Highly suggest you look at that, because there's ways to calm that down. So it may not be that you have to detox the poison anymore. It's what the poison did to your body that you have to calm down. So there's in that video I list taking flavonoids and being careful with exercise and zero alcohol and some general detoxification support and stimulating parasympathetic nervous system. So there's all sorts of different recommendations that I go through on that. So just understand, anything can trigger that. So, you could be, living a fairly healthy life, and, you bang your head, and now your life is just completely changed. So this is where, lots of times people come to us and they say, my life changed completely when this happened. When I took this medication, I had a reaction. When I had a car accident, I had a concussion. My life has never been the same. You have to think, this person has microglial priming, or worse, this person has autoantibodies to neural tissue. We need to find the triggers, calm it down. We need to calm down that inflammation and get to the source of this. That would be my biggest recommendation, trying to get to the source of what's really causing the problem. Next question. I saw a video of yours saying that most cancer patients shouldn't eat dairy. Is that for all cancer patients? Can we still eat butter? Well, yes and no. So most cancer patients shouldn't eat dairy. Why is that? So I alluded to it, the first question of this call, is that dairy stimulates a pathway in your body called mTOR. So this mTOR pathway, if it's upregulated, is going to increase replication rates. And dairy increases mTOR because dairy has growth factors. So anything that's going to increase growth, you have to be aware of with cancer. So dairy isn't the only thing that increases growth. There's certain nutrients that increase growth, like copper. So lots of times we'll see cancer patients come in and they're taking a multivitamin with copper. Well, copper increases growth. Cancer patients should be on copper. And going back to that one question that I had about the NF2 gene, about meningioma, another thing I should mention on that I just thought of right now is when you have defects on tumor suppressor genes, you have to be more careful of another nutritional product, not to be taking it. So I don't think any cancer patients, or let's say it a different way. I think every cancer patient should be careful of their supplements that they're taking. I don't think they should be taking, in general, I don't think cancer patients should be taking copper. And in general, I don't think cancer patients should be taking methyl groups. So what are methyl groups? So methyl groups are supplements that have a methyl group, a C with 3 H's. What is that? Where would you get that? In methylcobalamin. So in your B12 supplement. So where would you get methylcobalamin? If you're taking just a B12 supplement, look at the back of it. Does it say methylcobalamin? If you have cancer, I don't think you should be taking that. If you have a supplement that's methylfolate, I don't think you should be taking that either. And lots of times you'll get that in a multiple vitamin. So a multiple B complex, it'll be methylcobalamin or methylfolate or L5 methyl tetrahydrofolate. That's what it'll be listed on the back. Why should you avoid that? Why does it tie to tumor suppressor genes? Because methyl groups, one of the benefits in their bodies, they help silence genes. They help turn genes off. Well, if you know you have cancer or you have tumors and they are tied to tumor suppressor gene defects, possibly, methyl groups will silence tumor suppressor genes. So they'll turn off tumor suppressor genes. And remember what I said, if you were with me a few minutes ago, is your best way to fight cancer internally, cellularly internally, is that when a cell, you get something inside of a cell, a toxin or something, if it inadvertently damages the DNA, so the DNA starts to rapidly reproduce, it'll stimulate your tumor suppressor genes. What your tumor suppressor genes do is they basically cause an internal, from the inside out, destruction of the cell. So they stimulate the intrinsic apoptotic capsase pathways, and they help the cell die so that you never get a diagnosis of cancer. Well, if you're taking a ton of methyl groups, you can silence those genes. You can turn them off. So I'm not a fan of that. I'm also not a fan of just, a lot of people, practitioners that do genetic testing will look at your MTHFR gene and go, oh, you have a defect on 1298, or you have a double allele defect on 677. So we have to put you on methylfolate and we have to put you on methylcobalamin. That's just not good practice. Even if you have a double allele defect on both 677 and 1298, see, you have to look at everything else. If you have defects in your biopterin pathway and your serotonin genes, and you use excess methyl groups, you're going to stimulate excess production of serotonin, which is not good. It's going to affect you emotionally. It's going to cause rage and anger issues and all sorts of things. You have to take a 30,000 foot view of your genetics when you do genetic workup. You don't just treat a gene defect. And certainly if you have cancer, you have to be more careful on that. Now, the only exception to that, you have to look at the patient holistically. If a person has homocysteine issues, you might have to give them methyl groups for a period of time. So again, it's not just one thing, but certainly if a person has a disorder where they're producing meningiomas or fibromas of some kind, and it's because of a tumor suppressor gene defect, you have to be more careful. If you have a cancer diagnosis, you have to be more careful of methyl groups. Look forward to your weekly health hour. Learn so much. Why, thank you. Hopefully you're learning and I'm not doing this in vain, so I'm glad you are thankful. Okay, next question. There are a lot of Instagram and Facebook videos and posts that claim this or that nutrient cures cancer. What do you have to say about these claims? I'd say be very, very careful. So I'm not a fan of that. I just do not like alternative practitioners. They might have the best heart, in the world, and they're trying to help cancer patients, immensely. They're trying to give the best advice, but everybody is unique. And to say, oh, this cures cancer, I've seen Facebook posts like that where people create really pretty memes that say, turmeric kills cancer in 100% of or some silly thing like that. Well, the truth is, if you took a petri dish and you put cancer cells in there, you could put evaporated water in with it. It would probably kill the cancer cells. So it doesn't mean that evaporated water kills cancer cells or some silly thing like that. It's just, to me, it's just foolishness. Everybody's physiology is different. You got to look at the big picture. You got to treat people individually. And I think it gives alternative practitioners a black eye, honestly, when you see claims like that, or when you see quote unquote nutritionists make certain claims that are just not completely honest. And I think there's danger in that. I think it gives people, wrong thoughts about what's going to help deal with their cancer or their serious disease. I see a lot of Instagram posts like that, and I just unfollow those people because it's just I think they influence people the wrong way. Especially we live in this world of influencers, right? Well, you got to be careful who you are allowing to influence you. The Bible is very clear that we're supposed to be careful that we protect our mind so that we don't allow bad influencers, all sorts of that going on. So you have to be careful with that. So no, I'm not saying there's not validity in anything, but when you start making claims, then you do have to be careful. I struggle when you hear claims, and I just talked to somebody the other day that they said they're starting to drink alkaline water because Dr. So-and-so said that alkaline water is the best thing. Oh my word. It's like, I've talked about this in the past lots of times. That's just not the right thing to do. Please don't do that. You're not alkalizing your system when you are drinking alkaline water. You're not alkalizing your system doing anything from an oral standpoint. So it's just really poor understanding of physiology. And that just makes me really sad. Okay, last question. Is a Rife machine the best way to kill cancer? I can't remember if I had this on last week or not. I would say the Rife machine doesn't kill cancer. Again, you have to be careful about any claims that you're making. I think a Rife machine, properly programmed, properly working with the right frequencies for that person that has cancer, can help your immune system kill the cancer. But I don't think the Rife machine directly destroys cancer, kills cancer. Even though I think anybody with cancer should be using, I think everybody with cancer should be using a Rife machine. I don't think I'd be talking to you right now if I didn't use a Rife machine for my cancer. And I will stand by that till my death. I really think that's, besides the grace of God, I think God led me, to be able to program it right for me and to get the benefits from it. But I also say that it's not a magic wand, and it works in conjunction with the person's immune system and other things that you're doing. So all those things together are the best way to help deal with cancer. And you got to take a big picture view of everybody, because again, everybody is unique. So, all right. Well, thank you for being with us again on this Holistic Health Hour. I remind you to go to holistichealthhour.com, where we have all our past shows, videos, and we have really nice little narrative that goes with it, so you can see what video you might want to watch and the questions that were asked in that. Also, a reminder, go to ConnorsClinic.com. Highly recommend our courses. We got them on just steal deal prices because I just literally want to get people help and get the information out there. So start working through the courses, and you're going to learn a ton. I know you'll have a lot of aha moments. On ConnorsClinic.com, you can also search our blogs for any other question you have. All right. God bless. go to Holistic Health Hour if you want to ask questions for next week. Post those questions so we can get them on for sure. All right. Bye-bye.